Good day to all. This is Eric Brenner joining you for another session of PUBH 700. For starters here, we have a dramatic shot of President Obama in the Oval Office talking to Ebola survivor Kent Brantley. This is an example of how the Ebola story has come to involve government at the highest levels. Today, as you see on your screen, we will be focusing on infectious diseases. We know that you've had other sessions which have touched on infectious diseases, but this session will be devoted exclusively to that topic. Here is President Obama again, and if you look carefully at the background, you'll see that he's speaking this time not from the White House, but from the Centers for Disease Control in Atlanta, where he met with CDC staff to discuss the Ebola crisis, again showing that this is an infectious disease issue which has attracted attention from government at the highest levels. Another example of high-level involvement is seen in this picture, where we have Dr. Margaret Chan, who is Director General of the United Nations' World Health Organization, based in Geneva. And here she is addressing the UN Security Council, also about Ebola, pointing out that Ebola has become a matter of concern not just in medical terms, but even in political and global security terms. Here is another picture taken in the White House, and here is another president. And take a good look and see if you can remember who this president might have been. If you said Gerald Ford, then you had it right. You may remember that President Ford succeeded President Nixon back in 1976. The question here is, why is the president getting an injection in front of the media? And perhaps some of you may know the story. Can you remember what the story was? It was the swine flu episode of 1976, when the entire population of the U.S. was asked to get vaccine against a strain of flu called swine flu, and President Ford agreed to have himself vaccinated in front of the cameras to show that if it's okay for the president, it might be okay for you too as well. And speaking of getting an immunization in front of the cameras, here is President Obama himself. This was a few years back in 2009, getting his own vaccine for the 2009 flu virus, also sometimes called the swine flu vaccine. So in a way, history repeated itself there. Now, when we talk about controlling infectious disease in society, there are different ways in which we may consider this issue. First of all, the way in which we most commonly think about infectious diseases, that's the individual patient seeing a doctor or nurse about their particular problem, as you see on this slide. A higher level would be when an infectious disease might involve not just one patient, but a number of patients in the same hospital ward or unit. And you see some examples there, which you can read on your screen. Obviously, this is a little more serious since it goes beyond the problem for a single patient. Even more severe would be an epidemic of some infectious process that might involve an entire hospital. And you see there some examples also on your screen. So as we are moving up the scale here, you can see that the consequences and the thought process and control methods needed to address an infectious disease problem may very much depend on the level at which it is occurring. Beyond a hospital, we have here some examples of a community-wide outbreak. For example, example 3 you see here, SARS in Toronto. Back in 2003, you may recall that the entire city of Toronto was almost in a lockdown situation because of SARS involving the entire city. Beyond a city, you may sometimes have outbreaks or epidemics involving entire states. If you look at the fine print on this slide here, you see titles of various articles where we talk about statewide outbreaks for different kinds of diseases. The particular diseases don't matter so much here as the fact that you would have people affected in many parts of the same state. And continuing along the same lines of thought here, we could also have some outbreaks that involve not just a single state, but a number of states. You can see we're getting into something which would be more serious, by now certainly attracting the attention of the media and the press, and concerning and arousing anxiety in people in neighboring states, saying, "Oh, I wonder if this is going to affect me and my family too." And finally, at least as far as the national level, would be something which sweeps really the entire USA coast to coast. Take a look at this slide and you will see in the upper left a little circle in northern part of Queens, not far from LaGuardia Airport, if you know New York. And to the right we see a cluster of red dots. Those are people who had a strange kind of viral encephalitis in the fall of 1999. That turned out to be due to the introduction of West Nile virus into the US, a virus which had not been seen in this country before. But look what happened by 2004, just 5 years later. This virus, which is really a virus carried by birds and spread from bird to bird and sometimes from bird to man by mosquitoes, actually went coast to coast. Poor little Washington up in the northwest there was the only state to have really escaped at that point. So we're moving up to a higher and higher level. Now sometimes infectious diseases may affect not just a single country, but a whole number of countries on the same continent. You have here the example of yellow fever, a disease which we had in the US during colonial era. In fact, right here in South Carolina, we had outbreaks in Charleston and elsewhere. We no longer have this particular disease in North America, but we can see that in South America and also in the central part of Africa, this is still a disease to be reckoned with. So we're talking about infections here that affect people on a continental level. Another example here of continents involved would be the example of polio, which is now almost eradicated from the world, just still exists in a few countries. Here we see in Asia, India, Pakistan, and Afghanistan, and Nigeria, and a few other countries in Africa. The map changes slightly from year to year, but this is pretty much a reflection of where we stand now. Notice that the Western Hemisphere, that is North and South America, are now polio-free. That is, polio has been eliminated in the Western Hemisphere. We will come back to that notion later on. And you can just visually take a quick look at these slides, and you can see here in red the parts of the world which had ongoing transmission of polio back in 1988, and over the years how the number of affected countries has gradually shrunk as the world progresses towards elimination and hopefully global eradication of polio. Finally, of course, you can have diseases that affect not just several continents, but really all the continents in the whole world. The example we have here is of HIV infection. We can see that HIV is more common in some areas than others. Notice especially the concentration of dark color in southern Africa, but all parts of the world are affected. So this would really be an infectious disease process which is affecting the entire world. And this is a follow-up there showing here people living with HIV/AIDS according to United Nations estimates. Again, a global pandemic, we would call this, not just epidemic, but something that involves the whole world, we would call a pandemic. Now, what else is there behind there? Beyond a pandemic, this is a little bit tongue-in-cheek, but when the Apollo 11 astronauts, Armstrong, Aldrin, and Collins, came back from the moon in 1969, there was concern, it was really theoretical, that perhaps there might be some microbes on the moon that they might bring back to Earth, and it might be safer to put them in isolation initially, and that's where they were kept. So look, who is that coming to greet the astronauts looking in through the window? That's President Nixon at the time, but he couldn't shake their hands because they were in isolation. This slide summarizes what we saw in the previous several slides. Let's pause for a minute to consider the current Ebola outbreak, which is getting so much news. At what level would you say the Ebola outbreak is currently being played? We now have some pictures that can put some actual places behind those names that we saw before. This is a picture of the Richland County Health Department. Those of you who live in Columbia are familiar with this. And this is where we have a group of people who would be involved in caring for infectious disease outbreaks right here in Richland County. And this is the DHEC building where the disease control staff works, and this would be the headquarters for working on outbreaks that are affecting the entire state or particular regions of South Carolina. Here we have a map of the Atlanta area. Why are we going to Atlanta? Because the U.S. Centers for Disease Control is located there. And it's interesting to notice that CDC has a number of campuses around that metropolitan area. As we'll see, this actually is the site of the current CDC headquarters. Interesting to note that back in the late 1940s, this was pretty much an undeveloped part of Atlanta, 10 miles from downtown, and little did they know that the U.S. Centers for Disease Control would be headquartered there. By the way, does anyone happen to know why the CDC, which is a major federal agency, is not located in Washington, D.C., as most federal agencies are, but happens to be located in Atlanta, Georgia?
I don't know. Why?
It's for historical reasons, because during World War II, many soldiers in training, and we had 8 million men under arms during the war, were training not in Minnesota or Maine where it's cold, but were training in the Deep South. And there was a lot of concern that malaria might still exist in the southern U.S., so a federal agency was set up to control malaria in wartime areas, as they called it. And they did surveillance for malaria and did laboratory work. And after the war, rather than dismantling this institution, it was set up to become the Communicable Disease Center. That was the first name of the CDC, and that's why we happen to have the CDC here in the Deep South and not up in Washington, D.C. Here is a picture of the CDC headquarters as it was in the 1970s and actually through the 80s and 90s. This is the new CDC headquarters on Clifton Road in Atlanta. I mentioned the road because those of you who are familiar with Atlanta may note that this is just right down the block from Emory University. Here is the CDC campus in an aerial shot, as you see right next to the Emory campus. Now, this is in Washington, D.C. This is the headquarters of the Pan-American Health Organization, which is responsible for communicable disease control in the Western Hemisphere. I should add that PAHO, as it's called, is actually also the WHO regional office for the Americas. And finally, looking at things at the global level, here is a lovely aerial view of Geneva, Switzerland, with the French Alps in the background. And what do we have in Geneva? We have the headquarters of the World Health Organization. A question for you to ponder is, who actually runs the World Health Organization? How is it governed? And where does it get its funding from? This slide just shows a portion of the table of contents from a book called Control of Communicable Diseases Manual. Let's pay close attention here because some of the concepts and questions raised here will become the basis for a subsequent assignment. The main thing to notice here is how many diseases there really are. You see on the left part of your screen a number of diseases that start with the letter A, and on the right side a number of infectious diseases that start with the letter E. In all, there may be not just dozens but several hundred, and that presents a real challenge for us in terms of how we can make sense and structure all these diseases in our minds. Now, thinking back to the previous slide, we saw that there are really hundreds of different infectious diseases. And one challenge we have is to try and have a conceptual framework that can help us think through any infectious disease, no matter which it is. So do pay close attention to some of the points made on this slide, which suggest that a simple model with 3 parts can help us think through any infectious disease question that we have to deal with as parents or as professionals or public health practitioners. On the left, we have the notion of reservoir. That refers to the question of where the bacteria or virus or pathogen resides. Notice 3 possibilities: somewhere in the environment, somewhere in an animal, or in humans. Then on the far right, we have susceptible hosts. What does susceptible mean? It means not immune. Obviously, if people were immune to a particular disease, then we would have no cases of that disease if everyone were immune. And then the challenge for the pathogen and the challenge for us is the question of how the organism is going to go from the reservoir to the susceptible host. And you see a number of possibilities here: direct contact, droplet spread, airborne, and so forth. And those are different ways that pathogens such as bacteria and viruses and protozoa can then infect a susceptible host. So you will shortly have a brief exercise to help you practice structuring your thoughts about a particular infectious disease using this simple model: reservoir, mode of transmission, and susceptible host.